Hello, my name is Sierra Martin, and this is my presentation on maternal mortality rates in Black women. Maternal mortality remains a pressing public health issue in the United States, with rates significantly higher than those in other developed nations. This issue is further exacerbated by pronounced racial disparities, particularly affecting Black women. Recent data from the Centers for Disease Control and Prevention indicates that Black women are 3 to 4 times more likely to die from pregnancy-related complications compared to their white counterparts. The maternal mortality rate for Black women stands at 69.9 per 100,000 live deaths, compared to 26.6 for white women. The rationale for focusing on this problem is rooted in the critical need to address these stark disparities and improve overall maternal health outcomes. High maternal mortality rates among Black women reveal systemic issues within the healthcare system, including inequities in access to care, quality of care, and broader socioeconomic determinants. Addressing these disparities is essential to achieving health equity and ensuring that all women receive the necessary care and support during and after pregnancy. By concentrating on this issue, we can gain a deeper understanding of the barriers faced by Black women and work towards improving health outcomes and creating a more equitable healthcare system. The primary target audience for this issue includes non-Hispanic Black women of reproductive age, particularly those who are pregnant or recently postpartum. This group is at the highest risk of experiencing adverse maternal health outcomes. The audience encompasses a diverse range of individuals across various socioeconomic statuses, geographic locations, and healthcare access levels. The life course stage of the target audience covers the preconception, prenatal, and postpartum periods. Maternal mortality can occur at any of these stages, but the majority of deaths occur during childbirth or the immediate postpartum period. During the prenatal stage, efforts focus on monitoring and managing health conditions to prevent complications. The postpartum period is critical for addressing any emerging health issues and ensuring proper follow-up care. The first contextual factor influencing the problem and target audience is socioeconomic status. Socioeconomic status is a profound factor influencing maternal health outcomes. For Black women, socioeconomic disadvantages often intersect with various aspects of healthcare and overall well-being. Black women are more likely to experience poverty compared to their white counterparts, which limits access to essential resources such as quality healthcare, nutritious food, and safe housing. The stress associated with economic hardship can exacerbate health problems, increasing the risk of complications during pregnancy and childbirth. Research has shown that economic instability is linked to higher rates of preterm birth and low birth weight, both of which contribute to increased maternal and infant mortality. Furthermore, Black women are more likely to work in jobs that do not provide adequate health insurance coverage or paid maternity leave. The lack of insurance can lead to delayed or inadequate prenatal care, which is crucial for identifying and managing potential complications early. Additionally, inadequate maternity leave can cause financial stress and limit the ability of new mothers to attend postpartum appointments and receive necessary follow-up care. Educational attainment is another important factor. Lower levels of education are associated with reduced health literacy, which can affect a woman's ability to navigate the healthcare system, understand medical advice, and adhere to treatment plans. According to the National Center for Education Statistics, Black women on average face educational disparities that can influence their health outcomes and access to information about maternal care. Access to quality health care is another critical factor influencing maternal mortality, and Black women often encounter several barriers. Medicaid expansion has improved access for many low-income women, but gaps remain for those in states that have not expanded Medicaid. Additionally, even with insurance, Black women may face challenges related to the availability of providers, particularly in rural areas. Insurance coverage alone does not guarantee access to quality care. The quality of care received can vary significantly based on factors such as location, provider experience, and the presence of specialized services. Implicit biases among healthcare providers can negatively impact the quality of care that Black women receive. Research indicates that Black patients are often treated less aggressively than white patients, resulting in underdiagnosis or delayed treatment of serious conditions. For example, studies have found that Black women are less likely to receive pain management during labor and may experience delays in the treatment of complications. The lack of cultural competency in healthcare also affects maternal outcomes. Providers who are not trained to understand and address the cultural and social needs of Black women may inadvertently offer care that does not align with the patient's preferences or needs. This can lead to a lack of trust in the healthcare system, further discouraging women from seeking timely care. Systemic racism and discrimination have far-reaching effects on maternal health. Institutional racism manifests in various ways, including disparities in healthcare quality and access. Systemic issues within healthcare institutions can lead to unequal treatment and exacerbate existing disparities. For example, research has shown that hospitals serving predominantly Black communities often have fewer resources and lower quality of care compared to those serving predominantly white populations. Chronic exposure to racism and discrimination can lead to significant psychological stress, which is linked to adverse health outcomes. Stress hormones such as cortisol can negatively affect pregnancy, increasing the risk of complications such as preeclampsia and preterm birth. This chronic stress is compounded by socioeconomic disadvantages and can contribute to the higher rates of maternal mortality observed among Black women. Historical injustices, including the legacy of slavery and segregation, have created enduring disparities in social determinants of health. These structural inequities have long-term effects on the health and well-being of Black communities. For instance, neighborhoods with higher Black populations often face challenges such as limited access to healthcare facilities and higher rates of environmental hazards, all of which contribute to poorer maternal health outcomes. Medicaid expansion under the Affordable Care Act has been a significant policy intervention aimed at improving maternal health outcomes, particularly for low-income women, including many Black women. Medicaid is a critical source of healthcare coverage for pregnant women, providing access to prenatal care, labor and delivery services, and postpartum care. In states that have expanded Medicaid, there has been a notable improvement in maternal health outcomes. For example, a study published in Health Affairs found that Medicaid expansion is associated with reduced maternal mortality rates, particularly among Black women. Expanded coverage helps address barriers such as lack of insurance, which can prevent women from seeking timely and adequate prenatal care. Medicaid expansion also includes provisions for expanding postpartum coverage, which is crucial for monitoring and managing health issues that can arise in the months following delivery. However, Medicaid expansion is not universal. As of 2024, 12 states have not expanded Medicaid, leaving a significant number of low-income women without adequate coverage. This inconsistency creates gaps in access to care and perpetuates disparities across different regions. Even in expansion states, Medicaid often provides limited postpartum care, with coverage typically extended only for 60 days after delivery. This short time frame can be inadequate for addressing chronic conditions that develop or are exacerbated during pregnancy. Efforts should focus on advocating for Medicaid expansion in non-expansion states and extending postpartum coverage to address long-term health needs. Community-based programs play a vital role in addressing maternal mortality disparities through grassroots efforts, advocacy, and support. Organizations such as the Black Mamas Matter Alliance are at the forefront of these initiatives. BMMA focuses on a range of activities including policy advocacy, community education, and direct support for Black mothers. BMMA works to amplify the voices of Black women and advocate for systemic changes to improve maternal health outcomes. Their efforts include creating educational resources about maternal health, offering training for healthcare providers and supporting policies that address health inequities. One of BMMA's key initiatives is the Black Maternal Health Week, which seeks to raise awareness about the disparities in maternal health and promote community-based solutions. However, many community-based programs operate with limited funding and resources, which can restrict their ability to scale up and reach more women. Insufficient funding affects their capacity to provide comprehensive services and sustain long-term initiatives. These programs also often struggle to integrate with existing healthcare systems, leading to fragmented care. There is a need for better coordination between community initiatives and formal healthcare services to ensure seamless support for Black women. Enhanced funding and resources are needed to scale community-based programs and improve their integration with formal healthcare systems. Training programs aimed at reducing implicit bias among healthcare providers are essential in addressing the disparities in maternal health outcomes. The American College of Obstetricians and Gynecologists offers several resources and training modules to help providers recognize and mitigate their biases. ACOG's implicit bias training for healthcare providers is designed to educate providers about the impact of biases on patient care and to promote practices that ensure equitable treatment for all patients. Additionally, the Perinatal Quality Collaboratives are state-based networks that focus on improving perinatal care through quality improvement initiatives. PQCs often include training components for healthcare professionals to enhance their understanding of maternal health issues and to implement best practices that reduce disparities. However, implicit bias training is not universally implemented across all healthcare facilities, and its effectiveness can vary. Some providers may receive training but fail to apply the principles consistently in clinical settings. There is often a lack of rigorous evaluation and follow-up to assess the impact of training on actual care practices and outcomes. More comprehensive evaluation frameworks are needed to measure the effectiveness of the programs and ensure they lead to meaningful changes. Expanding the scope of implicit bias training and ensuring rigorous evaluation to measure its impact on care practices and outcomes is essential. Doulas and midwives offer personalized, culturally competent care that can significantly improve maternal outcomes. Research indicates that the presence of a doula during labor can lead to better birth outcomes, including reduced rates of cesarean deliveries and improved maternal satisfaction with the birthing experience. For Black women who may face additional barriers and stresses during pregnancy, doulas can provide crucial emotional and practical support. Programs like the Doulas of North America, or DONA, and various state-based doula networks focus on increasing access to doula services for underserved populations. These programs aim to reduce maternal mortality by offering continuous support during labor and enhancing the overall quality of care. Midwifery services, which often provide a more holistic and patient-centered approach to prenatal and postnatal care, are also critical. Certified nurse midwives, CNMs, and certified professional midwives, CPMs, can offer care in settings that may be more accessible and less intimidating for some Black women, addressing both medical and emotional needs throughout the pregnancy and birth process. However, access to doula and midwifery services is uneven, particularly in rural or low-income areas. The availability of these services can be limited by geographic and financial barriers, making it difficult for all women to benefit from this type of care. Many insurance plans do not fully cover the cost of doula and midwifery services. This lack of coverage can prevent women from accessing these beneficial services due to cost constraints. Expanding access to doula and midwifery services by increasing availability in underserved areas and improving insurance coverage for these services is essential to improving maternal health outcomes. In conclusion, addressing maternal mortality among Black women in the United States is an urgent public health priority that requires targeted interventions across multiple levels. By focusing on the reproductive life course stage, we can directly address the critical periods where risks are highest. The disparities faced by Black women are rooted in systemic issues such as racism, economic instability, and inadequate access to quality health care. While existing programs like Medicaid expansion, community-based initiatives, and implicit bias training offer important steps forward, significant gaps remain in ensuring equitable access and effective care. A comprehensive approach that integrates cultural competency, addresses societal and political barriers, and expands successful interventions is essential to improving maternal health outcomes and achieving health equity for Black women. Thank you for watching. My name is Sierra Martin, and this has been my presentation on maternal mortality in Black women.